days, we feel like the last mile transportation of cold chain has no visibility. The guy who picks up that blood bag, we don't know where he's going. He might be having a chai in, Nilofer. We don't know how long, that it's going to take by the time it reaches and in what condition it's going to be. So we wanted, from day one, we said, we are going to build this new product and it will have built-in monitoring and it uses AI to monitor all these devices and identifies in case of issues. And that data in the future can be integrated with other systems such as Ozone's internal systems, so that prediction using AI can be made. So we are contributors, from a physical kind of sense of this data, and overall, hoping to contribute towards this grand vision of enabling smooth interventions for patients.
Great. No, I think instead of being worried about AI disruption, taking away jobs and all that, there should be a mission to solve problems on education, problems on health like this. We can probably keep all our young people busy solving this for ourselves and export it to the entire world, right? Because like all of you have been hinting at, I was also thinking the same thing. UPI is a great example of a digital stack. It's time we have a health stack. It's time we have an education stack, right? So great insights, Rao. Tushar, I would want to extend the same question to you in terms of how do you see the multitude of technologies, again the AI, blockchain, digital twins and all of this, in kind of optimizing the supply chain management? And are you seeing that adoption or are we still talking? Because I remember working on a case study, which I'll talk after you have finished your talk, almost about 8 or 9 years back with Pfizer on blockchain, and I still don't see that on ground. So I would want you to, since you're a practitioner deep into the industry, I would want you to tell me what is being visualized, what is being visioned, and how far has the adoption started? Is it going to be 5 years, 10 years, 15 years? How long will it happen till all of this gets sorted?
So first of all, I think MIT numbers say that 80% of the POCs fail. They don't reach production. They never see the end of the light of the tunnel. But having said that, we are talking about virtual employees getting hired. In my team, we have a virtual employee. She never visits office, but she is always working 24/7 because I have hired her as an agent. I mean, it's an agent which is built on our system who operates on a 24-hour basis. She never gets tired. And I'm hiring more of such agents so that they come and they work and they go. And I don't have a human dependency for that matter. But the fact of the matter is, hallucinations are real. Someone asked ChatGPT some months back rather, who was the lone survivor of the Titanic accident, and it responded as Rose from the movie. But that's not the case. I mean, there was some guy called Michael who survived the whole tragedy. But then because the correlation with ChatGPT or the LLM has made, because many people might have spoken about Titanic, the Rose, and all this Jack wala scenario, probably that is the reason correlations are made. Similarly, someone asked what is the favorite food of French people in France. In Paris, it responded French fries, which is again not the case. But having said all that, I think today we are living in a world where every month a new LLM becomes more powerful than the previous one. 2 months back, we were actually talking about Claude, Opus, and all those new LLMs which came in. Last month, GPT released 5.5, which is like, again, better than Claude statistically. Just 2 days back, it was Mythos 5, or Fable 5 now from Claude again. So these guys are like, every month, the world is going bizarre. A lot of changes are happening. And like I mentioned, the world of tomorrow will have agents working on day-to-day operations. I mean, I can imagine all the procurement getting managed by just 1 or 2 people in the future companies, because most of other people who are supporting in contracting, in raising purchase orders in the system, hence and so forth, will be outsourced to agents. There will not be actual employees, there will be virtual employees for that matter, right? So that is the change which we are looking at. And another thing, Pankaj, where we stand today as compared to the world, I mean, first of all, we don't have a proper LLM in India, though there are a couple of attempts which are getting made. However, like for example, someone like China, if you go to YouTube and find dancing robots, you will be able to see humanoids which are doing kung fu or dancing along with humans. So the world is moving little faster than the way we are able to keep pace to. The moment you get used to a Claude opus, GPT becomes better than Claude. Then tomorrow again you have to change the tech stack, change the model, put it into the oven, bake it again, and rerun such simulations again and again. So I think world is moving faster as compared to the adoption trend. Humanoids will be the future to look at. I think that's the way AI ML with physical AI will be looking at overall supply chain efficiency. And I would actually argue that it's not about supply chain efficiency just, it's about supply chain resilience. Because the world is moving so fast with all these AI trends coming in, we all should take a stock of where we stand and start hiring those virtual agents and reduce our manpower related inefficiencies.
I'm smiling because my career is almost done now, so whether you hire virtual agents or real agents doesn't affect me. But so in the interest of time, I think I'll have one common question to all three of you. In terms of what is your future outlook? Imagine we are in 2035, and what do you see in supply chain of healthcare, and what is that one change that you'd want to see for that vision to be fruitful? It could be a policy intervention, it could be something to do with youth in terms of skilling and all, it could be anything else. So I want one point probably from each one of you as to what would be in your wish list, top in your wish list for all the things that all of you spoke about to be real, right? For patient care to be of high value and prompt and affordable, right? These are the combination of paradoxes that we have to deal with when we are talking about healthcare. So maybe we'll start with Dipti.
So Pankaj, it's not a new topic again. We all have discussed in our past rounds that if India can build UPI for 140 crore Indians, if they can build UHI by Ayushman Bharat, and UPI just to track even 10 rupees where it's going, I think we are at a place to build an intelligent, integrated, self-reliant supply chain UPI to be able to, have the best patient outcomes. Because at the end of the day, whatever we do, it is patient falls at the center of everything. And that's what I would envisage, and that's what I would envision for our India to build. And healthcare, then all of the healthcare operational efficiencies or financial levers or whatever you want to measure, whatever KPIs you want to measure can go back office, but patient will stand right in the centric of everything if this is built. So I would really envision for that.
Yeah, so don't hold back. I know there's someone sitting in the room who's very close to the central government policy making body. So maybe whatever you say now will directly go without any delay. So over to you, Ram.
Without effort, thank you.
Amen to whatever Deepthi has said, but from more of a selfish perspective, from Z-Block's perspective, we feel like there should be regulation to say that every cold chain shipment should have monitoring built in to just prove to ourselves that actually the material that is being shipped is being carried without any damage. Because unfortunately, just by looking at like a vaccine vial, you cannot tell whether there has been temperature damage or not. If an ice cream has been melted, you can actually physically see. Unfortunately, you cannot do that for a vaccine vial. So I wish that that kind of monitoring requirement is there for every cold chain shipment.
Great. Tushar.
So I think first of all, since we're talking AI, people should stop expecting AI as a magic wand, first of all. And because, like, for example, AI, if you ask anything, it will give you, first of all, it will respond. That's the biggest problem. Even if it doesn't know, it will still respond. Second thing, AI will also keep on pleasing you. You ask, how do I look today? And AI will like heaps of ton loads of good things about you, that Tushar, you're amazing, you can do this and all. Because AI always responds and AI tries to please you, right? So don't try to put AI in every bucket and say that this will solve by AI. It's not going to happen. One thing which I think will change is like patients at the center. I totally echo what Deepthi mentioned. Patients at the center. The cost of the medicine will be reduced drastically because the supply chain behind and the operations behind will be done much efficiently. And the cost saving which has happened in the past in the back end systems, upstream systems rather, will be translated to the cost of medicines you are looking to buy. So efficient company will produce more cheaper medicine, and India, being the pharmacy of the world, will be able to supply to more and more patients. Amen.
Great. Yeah, please.
I think I have one question for the audience. How many of you heard today saying that people who do not use AI will be replaced? I think it's an AI conference, so it's a fair question.
Is the question understood? She's saying, how many of you have heard the fact that if you're not using AI, you will be replaced, right?
Correct.
Yeah. I think you should ask the question the other way around. How many of you don't believe in that?
No, because everybody is using AI, right? So I think I would end this by saying that 90% of people are using AI, right? But only 10% stand out, people who are training the AI to be used today. So the people that are training the AI are doing all the manual process. And I think we should not actually underestimate that. All of us should have a human in the loop and use AI with caution and not get over carried away with AI, like you said. And we should all fall in that 10%. Thank you.
Great point. So before opening it to the audience for questions, I think I have one or two observations, quick observations. One, I think while technology can solve the problem of improving efficiency in supply chain management, I think we all also really have to worry about what about human greed, right? Technology can only do that much. So it's all about responsible people and technology in the hands of responsible people. Like just today it was announced that the Anthropic new models have now been restricted for usage outside US by anyone else. Right? So I think technology can only do that much. It's also ultimately about the human beings who are using technology. And in terms of the wish list, I think I would have two wish lists. One, my first wish list would be whatever my co-panelists said, that is heard. And second would be probably, I am a firm believer that India needs a lot of skilling. And again, these are important areas where high-skilled professionals are required. It's a huge talent paradox in our country that while we are worried about jobs for young people, we are not taking opportunities like this to build our careers. So with this, I'll probably open up the floor to audience if there are any questions. Yes, sir. Very valid question. I'll try and answer that and maybe open it up to my panel members also. The gist of the question is that AI is for big boys. They can invest big money, but will it reduce the cost overall, or will small players continue to use the traditional approaches? Am I right in my, yeah. So, sir, I would only say, if you look back, for last 20, 25 years, whatever I have been in technology field as a professional, technology is a great democratizing agent, because if you look at your own mobile phones today, when we started 20 years back, it used to cost us 16 rupees per minute incoming and 16 rupees per minute outgoing. Today it's almost free. You look at anything, technology, the advantage is initially there's a lot of investment that goes in, but once you're able to build those models, then replication, distribution becomes very, very easy. And that's where the overall cost comes down. And in terms of initially who invests, yeah, obviously the big players or government support or public funds, a combination of all this will happen. That's what I believe. But if there's any view that...
Yeah, so I think technology is not just a game of big boys, by the way. What I have seen is you can even start nimble. Start by hiring an intern. Yeah, and these kids are super smart nowadays. I have a few of them in my team, and I know they can crack tough nuts. So you just put up simple one or two use cases. First of all, identify use cases. Yeah? I mean, don't go for the big, high complex ones like drug discovery and all. No, those are very fancy for us to solve for. Maybe pick up small. For example, how can I summarize documents, multiple documents, thousands of documents? And it will, so AI talks in terms of tokens, right? So the token consumption will determine the cost you are supposed to pay for it. You don't need to have a high-end infrastructure like a GPU or a big server and all that thing is not needed nowadays, by the way. These models can be invoked by API calls, which are quite cheaper. So if you want to solve for a smaller problem, smaller use case, it will not cost you more than 1 lakh. Yeah, and it is, and I'm just giving you high-level numbers. Again, it will be much, much cheaper than this as well. But you can start looking at those small use cases, and moment there is a trust in the system that yes, this is helping me to improve my productivity, you will start seeing the funds coming in. I have seen people, boards, rather big boards, who don't believe in the power of AI, but we showing them some low-hanging fruits with a very minimal investment. They started funding us later, saying that, hey, look, why don't you take some more money and do a better ROI for the future? So yeah, people are going to change the way you look at it, but start small, the big things will come sooner.
Also, I think just to add, the AI that we are seeing today is not the final AI, right? AI itself is in a stage of evolution. So like there used to be an Orkut for social media. I don't know, many young people here would not know. We are in the Orkut age of AI. There will be a lot of new AI models which will be much more accessible, less expensive, more optimized, which can run on your desktop, which can run on your mobile phone, which can run on your watch and all that. Because I have seen these kind of evolutions 3 times in the last 20 years in different technologies. So I can say confidently that we are at a very early stage of AI. Very new kind of AI will come in the next few years. And some of these questions probably will not be very relevant then.
And like I said earlier on, technology adoption, the starting point is different for everyone. You know, you have smaller hospitals, mid-sized hospitals, larger hospitals, right? But the smaller hospitals doesn't need to do what the larger hospitals are doing, right? So the starting point is different for everyone. Larger hospitals might have an expansive EMR, right? But the smaller hospitals may have that EMR only in one department. Start with that department. Start small, but start. That's what I would say. Thanks.
Any other questions? All right, so if you don't have any more questions, thank you so much. Once again, I would like to thank the organizers, Yashoda Hospital, Dr. Chinnababu, and all the team for organizing such a beautiful conference, and especially to my fellow panelists for being such a wonderful panel. Thank you all so much. And like someone just before me spoke, that after lunch it's going to be reasonably tough for us to keep you interested and awake, but we'll try our best. And thank you to the host for organizing such a beautiful conference, and I'm sure all of you are having a wonderful time all through the day. Our panel is about supply chain management and the changing paradigm shift in supply chain management. And I have 3 extraordinary personalities with me. I've also had the pleasure of interacting with them in the last 2 weeks over this panel. And as they talk about their insights, you'll know. But I would want to probably start by asking them to introduce themselves, and then we'll take the questions forward. The context is, of course, from every tablet, every vaccine, every bio kit that comes to you, it goes through several countries, it goes through several different stakeholders, be it manufacturers, be it logistic players, be it technology players in today's world, hospitals. There's so many stakeholders involved. And if anything, COVID and the pandemic has taught us how we are all globally connected. And any disruption at any point of time can create a huge disruption in the overall supply chain management. How do we look at technology in terms of AI, IoT, and blockchain, making a positive impact in supply chain management? How do we work towards precision medicine? How do we ensure that the regulation is more proactive? And how do we ensure that the last man, last woman, somewhere in India, somewhere in Africa, somewhere in some other underdeveloped country, is also getting the benefit of medicine, pharma, technology, right? So this is the broad context that we will be talking about. We'll try and keep our conversation a little short so that you have enough time to ask questions. So please collect your thoughts if you have any questions. But I'll hand over the mic to my co-panelists and request them to give their brief introduction to start with. Deepti, over.
Very good afternoon, everyone. My name is Deepti, and I'm the MD and CEO of Ozone Hospitals. I'm also the chair of the FICCI Healthcare Telangana panel, and my experience comes from UK and India. I've been a commissioner in the UK for the National Health Services in the past, and now come back to India to be an entrepreneur and innovator. So I look forward to engaging with the panel, and I thank the host for inviting me to this great event. Thank you.
Good afternoon, everyone. My name is Rao Kurupolu. I'm co-founder and CEO of ZBlocks Logitech Private Limited. If you look at cold chain transportation today, most of the vaccines or blood and all, they are carried by passive boxes like plastic or thermocol with just ice in them. We looked at this problem when we started ZBlocks, that this is an age-old technology, and in this new age and world, AI world, we need to transform this. So we have invented a product called ActiPod, which is a battery-powered portable cold chain carrier, where it will maintain the right temperature for any of the medical products that need to be carried. And on top of that, you have real-time location and temperature data being sent to the central location. So all temperature-related wastage is eliminated. And it's also a green solution. So it's the right solution for the new age where AI is playing a big part of our lives. So I'm very happy to be part of this discussion. Thank you, Yashoda Hospitals, for having me on this panel.
All right, so I'm the last one to go. My name is Tushar. I come from this pharma company called Granules India, and I work with them in the capacity of Chief Transformation Officer. While it's an interesting title, and my job is actually making sure that I am bringing the best cutting-edge AI to the company. AI, robotics, automation is what I specialize in. While Deepti will bring the hospitals and Rao will bring the supply chain for the cold chain, I'll try to bring in the pharma and the tech part of it, the AI ML part of it as well.
Wonderful. I'll take this opportunity to introduce myself also. I'm Pankaj Diwan, founder of Idea Labs Future Tech Ventures and TalentFarm.ai. I also work a lot in the ecosystem, and that's where I'm connected with Dr. Chinnababu in this initiative. So without much ado, let's get started with our discussion. And Deepti, I'll first probably come to you. It's said that 30 to 40% of operating cost of hospitals is dependent on supply chain and the optimal usage of inventory. And traditionally, I believe that supply chain has been more a function of procurement. But are you seeing a change in that? And how are you looking at the intervention of technology also? Maybe that can be a second question. But to start with, what is your perspective on the whole supply chain management, and how does it affect patient care from a hospital point of view?
Thank you, Pankaj. Earlier, I think supply chain was just limited to procurement and a back office function. But now, I think it has moved from a back office cost center to patient clinical and safety norm. Basically, patient clinical and safety function. Because if you look at it at three aspects of the entire strategic planning in the hospital, we mainly look at